It is an undisputed fact. In fiscal year 2024, Medicaid costs for emergency services for illegal immigrants skyrocketed by 142% from the previous year to $9.1 billion.
All right, let's do this again. Fact-checking claims on how much we spend for emergency room care for undocumented immigrants every single year. And Caroline Levitt just claimed that number was $9 billion. And she said that that was undisputed. Now, is that true? We'll get to that in just a second. Because even if it were, that $9 billion is far less than the $20 billion line of credit that the president has offered to Argentina that has been very unpopular with his supporters. And it's also less than the cost of a single Gerald R. Ford class aircraft carrier. Those are $13 billion to build. But here's the thing with that $9 billion claim that Levitt made. It's not backed up by any public numbers, not from the Congressional Budget Office, not from the Government Accounting Office. Instead, according to the numbers that the public does have from the government, that total is closer to about $3.8 billion. And that makes up just a sliver of overall Medicaid spending, 0.4%, this tiny amount versus the rest of the money we spend on everything else when it comes to Medicaid. And a reminder, those immigrants aren't eligible for Medicaid except in kind of a roundabout way in those emergency situations. And they use less health care and have lower costs each year than people born here in the U.S. This is according to congressional research. So when it comes to the press secretary, she's got the benefit that it's hard to fact check her because typically hospitals don't actually track immigration status when they provide that emergency care. And again, this is all thanks to Ronald Reagan when he signed the Emergency Medical Treatment and Labor Act into law back in 1985, which requires hospitals to provide care to anybody in need, regardless of their ability to pay or their immigration status. And that same year, Reagan signed the Immigration Reform and Control Act of 1986, which gave amnesty and legal status to about 3 million immigrants. And when he signed it, he said it improved the lives of people hiding in the shadows who didn't have the benefits of a free and open society.
Our objective is only to establish a reasonable, fair, orderly, and secure system of immigration into this country, and not to discriminate in any way against particular nations or people.
Back to Levitt and those numbers. Even if they were accurate, let's put them into perspective. So undocumented immigrants pay about $100 billion a year in federal, state, and local taxes. And more than a third of those dollars go to payroll taxes that fund programs that these workers can't access. And that includes Social Security, unemployment benefits, and Medicare, $6.5 billion worth. In fact, without those undocumented immigrants contributing to these programs, some estimates say they'd go bankrupt. So before we start blaming undocumented workers for breaking the system, maybe we should recognize that they might be one of the reasons that the system is still standing.